Hi, my name is Jessica and I'm going to be your nurse. I'm going to go into the patient's room and I'm going to verify their name and date of birth, and I'm going to tell them that the doctor has orders to start an IV catheter, to administer medication or fluids while they're here. So at that point in time, I'm going to go ahead and identify the 5 medication rights, 6 medication rights, because I'm silly. Okay, so it's going to be the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. So then I'm going to ask the patient to, if there's any specific area they would like for me to start an IV catheter. And in this case, if there wasn't a specific area, I'm going to start at the hand or the forearm. So I'm going to go ahead and secure the tourniquet. Okay, I'm going to perform hand hygiene. I'm going to go ahead and palpate or milk the vein, and I found a good vein right here. Go ahead and release that, but I'm going to leave it there for time purposes. So I'm going to go ahead and perform hand hygiene again and put the gloves on. Now I'm going to clean the site. Try to get a good enough area so the tegaderm will stay good. I'm going to let that dry for about 10-15 seconds. And then at that time I'm going to insert, what I have is an 18 gauge, and I'm going to go ahead and do that now. I'm going to insert bevel up. A 30-degree angle till I get flashback. And at that time I'm going to go ahead and with the needle, I've got some gauze here. Just going to go ahead and put in there. I don't know what I'm doing there. Just kidding. Okay. I feel a little pressure here. Alright, and at that time I'm going to initial my tegaderm with my initials, the size of the gauge, the date and time. If I could have you just hold your arm like that, thank you. Okay, and I'm going to ask the patient how they feel, if there's any pain, and check for redness. I'm going to go ahead and also secure it with another piece of tape at the hub. And I'm going to release any air out of my saline flush. And that's what I'm going to scrub the hub. And flush. And then, once again, I'll ask the patient if they're feeling okay, and I should have released the tourniquet before I flushed. Sorry about that. Anyways, I would have released the tourniquet, and then I would document the patient tolerance, the patient education, the assessment and condition of the site, and then the location, the size and length of the catheter, how many attempts it took, and the type of dressing, which is Tegaderm, and the date and the time. And then I'm going to place my patient's call line within reach and throw away all my stuff and perform hand hygiene.